On the North Shore in St. Tammany Parish, there's a new facility and a new approach dedicated to handling mental health challenges before they get out of hand.
The Ness Center in Mandeville is the first community behavioral center of its kind in Louisiana. And as Tan Trung reports, its work could save lives and taxpayer money.
At the site of the old Southeast Hospital in Mandeville is the Ness Center.
So this is the Mobile Crisis Center.
With a 24-hour call center, it's meant to be a lifeline anytime someone on the North Shore is grappling with mental health problems or substance abuse. In past years, suicide rates in St. Tammany Parish exceeded national and state averages. The Ness Center is one more resource to address issues many have been reluctant to talk about.
People are talking about it, talking about depression, talking about anxiety. You know, the kids are having it. So I think it's always been there, but it's more at the top of the surface now.
We know it's a concern not only in our country, but here in our state and in our parish, and we want to get people the help they need.
At a time when law enforcement is expected to de-escalate encounters, St. Tammany Sheriff Randy Smith and his deputies will team up with the Ness Center. It represents a shift away from past approaches that prioritized arrests.
We would actually respond and somebody would call for help. Next thing you know, we're dealing with somebody who's schizophrenic, combative. We wind up with use of force complaints. We wind up going to the hospital. They wind up in jail. Deputies are hurt, lawsuits. So this minimizes that.
Under this partnership, a team of mental health workers can be dispatched alongside St. Tammany Parish deputies in certain crisis situations.
We get to partner with them on the scene and help that person get into care rather than go to jail or go to the emergency room.
With COVID's fourth surge straining hospitals, redirecting mental health patients to the Ness Center can alleviate pressure on medical centers. And by being more aware of a person's mental state, it may lessen the pressure on deputies to put them in handcuffs. In Mandeville, Tan Trung, Eyewitness News.
And in addition to having a licensed healthcare worker as part of the mobile crisis team, there will be peer specialists who can respond with law enforcement. Those specialists have been through mental health or substance abuse situations themselves, and they hope they can use that experience to de-escalate emergency situations.